Melanie, thank you so much for joining me on Social Impact Power Chats.
Very happy to be here. Thanks for having me.
All right, so just to kick us off, we define social impact broadly. I love the impact work that you're doing. Tell us a bit about you, your career, and how you bring impact to the table in your work.
Sure. So I originally hail from Los Angeles, California, where I grew up my whole life. Absolutely love it here. I'm based here again now, but my journey has taken me to a lot of different places around the US and abroad. So I went to school in St. Louis, Missouri at Washington University, where I studied psychology and then ended up going on to get my Master of Social Work and Master of Social Policy, which is really where I dove into what social impact is. However, my passion didn't start there. When I was a rising senior in high school, I was connected with a nonprofit organization that does diabetes education around the world, particularly in Spanish speaking countries. And I fell in love with their model. It's called AYUDA, American Youth Understanding Diabetes Abroad, and I'm now a staff member for them. But they take a very community based local approach. So anywhere they work, they have a local partner organization that is in touch with the community year round. And AYUDA provides financial, human resources, and other sorts of support to the local organizations with the idea of one day we don't need to go back, and we've helped to build up the capacity of the local organization. And I just really was inspired by this model of, okay, I'm not trying to fix it. I'm collaborating with others who know a lot more about the context and the problem and bringing whatever knowledge I can and skills I have to help sort of push them forward. But at the end of the day, it's about the families being impacted. And I took that into my studies and then into other impact work that I've done, mostly in the Dominican Republic, but also in Ecuador and other places around the world.
So, just thinking about like this rooting in the work, the fact that you have
Hmm.
been thinking about this, doing this, not even for your entire career, like pre-career
Hmm.
on, is such an amazing thing. What would you say to people, like in terms of finding that spark? Like, let's say somebody's listening to this who's in college or kind of thinking about how to find like their passion.
Hmm.
How would you recommend they get started? Like, what are the questions that you asked yourself, or maybe it was just kind of random and opportunistic? Like, so just walk us through what it was like to think about that early on.
Yeah, so my passion came from my own personal experience. I live with type 1 diabetes, and actually, through my endocrinologist, who's my diabetes doctor, I was connected with AYUDA. And so I think looking for something that may connect with your personal experience, where you can bring your own stories and your own experiences to the mix, and then collaborate with other people who may also live with a similar condition or be in a similar situation or completely different. I get to collaborate with people interested in medicine and public health and global systems all through this diabetes organization. So it's definitely gone beyond just my own life and what's been impacting me. From there, when I realized how important social work is and working in the context of a family situation, working in the context of their community and seeing the dignity and worth of every person, I started to steer my passion towards education, which is actually where my heart lies. While I love diabetes, it's very personal and connected to me. So I also wanted to do something that's not, in my life every day. And so I got into work with another nonprofit after graduate school that does education programming from preschool all the way through workforce development for young adults. And I found there that I could really bring what I learned about social impact and social entrepreneurship to a topic area and to education policy, where I felt like I was really excited every day to go in and do the work. And I still also get to work with that organization. So it's kind of combining my passions and my studies. And so I would say that if you know that you're interested in something, there's always a way to find a space to get involved, whether that be in social impact or even just, behind the scenes. We always need people who know how to do the research, who know how to, source the funds, because all nonprofits need funding. It's just the reality of it. People who know about business, because at the end of the day, while nonprofits do amazing impact work, they can't be successful without being run sort of like a business. You need to have an income, you need to have a business model, you need to have a strategic plan. So there's a lot of ways for people to bring their skills and their interests into a social impact or nonprofit space.
Amazing. So figure out your passion and figure out what your skill set is and
Exactly.
apply that. I love all of that. So,
Hmm.
I'd love to drop into your day to day. And, one of
Sure.
the things we met because you were
Hmm.
thinking about measurement and data. And
Hmm.
so, obviously you're working with people across time zones, across languages, multiple kind of core constituents, volunteers, local on the ground NPOs, families served, youth served, like all of these really important pieces of the puzzle. Um,
Absolutely.
Walk us through sort of how in your experience you've thought about data, and kind of what did you see that was a piece of the puzzle that was missing kind of before we met?
Yeah, sure. I think in order to make impact and to know that you're moving the needle forward, you have to have data and you have to have numbers in order to understand a baseline of where you're beginning. So that could be how many people are being impacted. If you're working in medicine, what are some baseline analyses to know where your patients or beneficiaries are at? If it's education, where are their knowledge levels currently? In order to know that you're actually making an impact and to isolate the impact you're having versus other influences in the environment, you need to start tracking data. For one of the organizations I work for, it's quite large and they had a lot of systems in place. But for AYUDA being such a small nonprofit, even though we've been running for over 2 decades, we needed to push ourselves to track our data more thoroughly. So we track data when it comes to fundraising, when it comes to volunteer participation, when it comes to impact on the families. And so we're trying to measure a lot of different areas, whether it be money, whether it be medical analyses, whether it be participation rates, attendance rates, years of collaboration. And we needed a platform that would give us all of that. It also allows us to more transparently report back to the families and also to our donors and larger supportive community what we're doing. Why is AYUDA the best organization to do this? And why are our collaborations with local organizations the most effective process? There's a lot of organizations that go, abroad, they do work and they come back after a few weeks and want to show beautiful pictures. And that's nice. We want to go beyond that. We want to show that our intimate relationship with the communities is actually making a difference in their day-to-day lives, even though one day we hope to not have to be there. The idea is that we're not, families are not reliant on foreign aid or foreign support. Rather, our local partner is able to do what they can do best and support their own community. But how do we know it's working? We need data. We need to watch the numbers, hopefully, get bigger and move up over time. And if not, where can we pivot, or what transitions can we make? What adjustments can we do in order to be even more impactful and more ingrained in what the community needs?
100%. And I would love for you to just sort of walk me through some data wins. Like, what are some things that you see as, growth, opportunities that have been realized, and what would be like a tip that you would give? My perspective is data is data. It doesn't matter if you're a nonprofit, a government actor, a for-profit
Absolutely.
business, like being steeped in information is universal. So what
Mm-hmm.
advice would you give? Like, what have you seen work that
Mm-hmm.
you think could be opportunity, that another person listening to this could say, oh, I could pick this up and apply it?
I think the same as you, that knowledge is power, and it also allows us to make more strategic decisions. So even if you're not familiar with data analysis, or you're kind of new to tracking numbers, it's really just thinking about what's my situation right now? Where am I starting? Where do I want to be? And the steps to get there. So even if it's very early on in the process, you're interested in starting a new movement or a new social impact venture, whatever it is, what problem do I see now? How do I know that it's a problem? Well, I don't just guess it's a problem. Maybe the problem is, for me, I'm interested in preschool. So, number of families that don't have access to high quality preschool. That's something I can find on Google. When I first started this work and when I was studying, I was learning different ways to find that information. I was calling around St. Louis and learning about early childhood centers. I found an internship with a collective that was working in different areas of education. And so just trying to learn what's going on now. And then, okay, what do I want to see change? Do I want to see more families getting access to preschool? Do I want to see more families having resources at home? Do I want to improve literacy levels? Do I want to, when it comes to diabetes, lower people's A1Cs, which is a measure of sugar in the blood over 3 months? What is it that I want to change? So then you can make an educated decision about how to get there. And I know those are a lot of big words that sometimes can be scary, but it's really, what am I starting with and where do I want to end up? And then thinking about the steps to get there. Is there someone already trying to get there that I can work with? Is no one trying to get there and I need to be the one to start it off? But really just understanding the situation before taking action. I think the worst thing we can do is just jump in and try and fix something we don't really understand. And data is really the way to give us the knowledge in order to make smart choices and to work with the right actors in the space in order to see the change we want to see.
One more question on this data piece, because as you know,
Mhm.
it's my obsession as well. I think one reason that people are nervous to spend the
Mhm.
time, energy, money on data, is because it's complicated and complex.
Yeah.
And to your point, you sort of already made this, like, just get started, which I totally agree. It doesn't have to be perfect. It just has to
Mhm.
be. That's That's critical. But I think the other thing that people are skeptical about is like, will anybody care? Like, let's
Right.
say we spend the time, the energy, the resources. There are things we're going to learn that are really interesting. We believe that.
Hmm.
Who's going to, is the juice worth the squeeze, right?
Sure.
And so I'm wondering if you could give us just like an example or two where the juice has been worth the squeeze, that you've actually seen the power of data put into
Mhm.
action sort of downstream.
Sure. I think one of the biggest pieces that not everyone wants to recognize because it can sound a little selfish and this work is supposed to be selfless is most people care because they believe in you as the person doing the work. And that's something that I learned, especially through fundraising efforts. I can have all of the numbers, but the reason why people care and want to see success is because they believe in you as the person transmitting the message. And so making this personal connection to the data, why do I care? Even if it's not my life situation, why do I care about this work? And then what about my audience or the person with whom I'm speaking can also be connected to this work? You have to tie in that personal part. Data can be very dry. Numbers aren't everyone's cup of tea. They can be fairly stale. And so bringing life to those. This happens a lot with the diabetes work I do. I can say how many kids come to our camp, how their blood sugar numbers have been more in range, all of that. But especially for people who aren't interested in diabetes or health, that doesn't mean much. So I tie it to a story. I tie it to an image. I tie it to my own experiences, over the past 13 years working with AYUDA. What changes have I seen in a child's life? I always tell a story about how I worked with my fellow volunteers, some local Dominican volunteers, and a young girl and her mom to help her give herself her first insulin injection on her own. And the next day she came back to our camp and she was ecstatic because at dinner time when she was at home, she told her mom, "Mom, I don't want you to help me. I want to do it myself." And she did it herself and she came back with this glowing smile, and that's what makes it worth it. So bringing stories to the data, she is not just a number. She's an individual. Her name is Leslie. She's beautiful. She's an adult woman now. This was years ago and she still is in touch with me. We still follow each other on social media. So that's the number in action. And it's just remembering that you bringing the story to it and allowing other people to see the story behind the numbers. And the numbers are just kind of the foundation to make sure we're doing the work well. But it's not about the number, it's about the human that's behind the number, and always remembering that the person comes first, because we are at the end of the day doing social impact about people and personhood and their livelihoods, not just, to show a pretty number at the end of the day.
Yeah. Well, and I think, I mean, your point is so well taken, which is like the left hand and the right hand are the complete picture,
Hmm.
right? And you need the data as the bedrock. And you also can't forget the purpose of all of it, which is the human centered
Hmm.
experiences and the stories of the actual people. So,
Hmm.
co-sign all of it. And I can't
Hmm.
believe it, but we're already at our last question because these chats always go so quickly. So,
Hmm.
final thought on where this whole thing is going. You see so much, you've
Hmm.
been doing this work for so long. Where do you see it going? Like, if you had a crystal ball, is there anything new or kind of interesting that you see coming down the pike?
Absolutely. I think that with all the advances in technology that we have these days and platforms like Ethos that are really focusing on measuring social impact, we have the ability to make more advanced analyses and to show more advanced impact than we could before. Obviously, stories I think are the number one. And then, like you said, having the data as the bedrock, but we're able to do so much more with it now. We can show visuals of the data, we can connect that to the pictures, we can share it, whether it be for funding, whether it be to get volunteers involved or to bring in new personnel or to work with different families and different communities. I think with technology and social media we really do have an opportunity to expand what we're doing and reach so much farther. At the same time, and I said this earlier, at the end of the day, I kind of look at my work as trying to put myself out of business. If I do a good job or the organizations I work with do a good job at the impact they're making, hopefully one day we wouldn't be needed anymore and the change will have been made. Obviously, I don't anticipate that within just my lifetime. There's always improvements that can be made and change that needs to be done. And I do hope to see that one day I don't need to do the same interventions I did before because they were done well enough that people's lives are actually improved. And I don't just, of course, mean myself in an isolated state, but with everyone who is connected with the work that's being done. Social impact is not meant to be forever because it's meant to solve problems. So if it's going on forever, we're not solving problems. And I would love to see, the future of social impact be direct, be intentional, be data driven, and then not be needed.
Amazing. Well, I hope that it is so.
Mhm.
definitely where all of us want this work to be going.
Hmm.
Obsolescence is the ultimate goal because it would mean that we had made it. Um,
Made real change.
Thank
Mhm.
you so much for joining me, Melanie. This is great. I really
Absolutely.
appreciate you, everything that you're doing with AYUDA, and your diligent pursuit of great data.
Thank you. And I appreciate getting to meet you and now being connected for over a year. And Etho's really been a life changer for IUDA. And I'm just really glad to be connected to a data focused social impact space.
Amazing. Thank you. Thank you.
Thanks.